Hello, my name is Dr. Kathleen Jude Estime, psychiatric nurse practitioner, and today we're going to do a lesson on TBI and how it affects ICP. To effectively prepare for the NCLEX with a focus on TBI, traumatic brain injury, and increased cranial pressure, nursing students should be familiar with the essential concepts that we are going to outline today. Now, understanding traumatic brain injury, the definition of TBI is defined as an insult to the brain caused by an external mechanical force leading to temporary or permanent neurological dysfunction. Types of TBI. Open TBI involves penetration of the skull, for example, a gunshot wound. A closed TBI, the skull is intact but the brain is injured, example, a concussion or contusions. Common causes are falls, motor vehicle accidents, sports injuries, assaults, and blasts. The types of TBI and associated conditions. Concussion is a mild TBI with temporary symptoms like headache, confusion, and dizziness. The contusion is a bruising of the brain tissue, often associated with swelling and bleeding. Hematomas. There are epidural hematomas, where there's bleeding between the dura mater and the skull, often results from skull fracture. There's subdural hematoma, bleeding between the dura mater and the brain, typically due to venous rupture. And intercerebral hematoma, which is bleeding within the brain tissue itself. Now, let's go to ICP. ICP is increased intracranial pressure. The definition of ICP refers to the pressure inside the skull, which is normally at 5 to 15, and above 20 are concerning. Causes of ICP is cerebral edema from various injuries or conditions, such as hemorrhage, tumor, infection, for example, meningitis, or hydrocephalus. The signs and symptoms of TBI and ICP. For mild TBI, you're going to see headache, confusion, nausea, dizziness, sleep disturbance. Moderate to severe TBI, you're going to see altered level of consciousness, which will be tested with the Glasgow Coma Scale, the motor and sensory deficits, and Cushing's triad, which is hypertension, bradycardia, and irregular respirations. It's important to understand the later phase of ICP is Cushing's triad. You're also going to see pupillary changes like fixed or dilated pupils. Diagnosis and assessment. For the Glasgow Coma Scale, which is a tool that assesses consciousness based on eye, verbal, and motor response, scores from 3 to 15, where lower scores indicate worse conditions. It's usually said less than 8, you must intubate. For neurological assessment, regularly monitor vital signs and neurological status. Imaging studies, you should expect to see CT scans or MRIs to detect bleeding or edema. It's important to understand the Monroe-Kelly doctrine. The Monroe-Kelly doctrine states that the total volume of intracranial content is constant and consists of brain tissue, blood, and cerebral spinal fluid, CSF. If one component increases, the other component must decrease to maintain normal ICP. Therefore, any increase in volume from any of these components, for example, brain swelling or bleeding, can lead to increased ICP. This principle is crucial for understanding how the body attempts to compensate for the changes in ICP and the importance of early assessment and intervention to prevent brain herniation and other life-threatening complications. So your nursing interventions. You're going to monitor vital signs. Watch for signs for neurological deterioration and changes indicative of increased ICP. In terms of neurological assessments, you're going to frequently conduct the Glasgow Coma Scale assessment and monitor for changes in motor response and pupil reaction. Positioning. You're going to elevate the head of the bed to 30 to 45 degrees to reduce ICP through venous drainage. Medication. Administer osmotic agents like mannitol or hypertonic saline to manage elevated ICP. Airway management. Ensure adequate airway protection, especially in patients with decreased consciousness. Seizure precautions. Implement measures to protect the patient if they are at increased risk. Patient education and family support. Educate patients and families about TBI. Understand that a vulnerable population is our veteran population. Understand the potential complications and importance of following up care. Discuss signs and symptoms that require immediate medical attention. By mastering these elements concerning TBI and ICP, you as a nursing student will be well prepared for the NCLEX, and it's crucial that you apply the Monroe-Kelly Doctrine to understand the implications of changes in ICP. I hope that you learned something. If you did, please like and share and place a comment. If you have any questions, please feel free to place a comment down below.